Hello, Blasters. How are we doing this evening? We had an amazing live feed last night. I was so excited to spend some time with you guys last night. It was pretty awesome. A lot of the amazing questions that came up. And there's never enough time in a day to get what we need to get done. So I'm really dedicating myself to my YouTube channel to put information out there that we don't really get the opportunity to answer sometimes on a live feed. I want to try to get so many questions and demonstrations done and within an hour. So I'm going to dedicate as much time as I possibly can to my YouTube channel and really get into certain treatment, not treatment, but sessions, blasting sessions, so I can show you techniques and different modalities like blading. I am a big fan of blading. Taping. I'm a big taping fan. As you can see, I took a vagus nerve class today, so we were stimulating our vagus nerve. So it was an awesome class. I loved it, and I cannot wait for his next courses. Dr. Perry is absolutely amazing. But yes, so I want to really get into how to treat knees. Knees are a very, very delicate joint because, as you know, there is only flexion and extension. Flexion and extension happen in the knee. The knee doesn't go side to side, nor does it rotate. So it's a very delicate joint. We have to make sure that it's tractioning, and moving perfectly. So I believe that blasting your knees is an absolute must because sometimes what happens, it's so easy for our bodies to compensate. So especially when we're getting in and out of the car, we completely forget that, the awareness is not even there as we're getting out of the car. We're getting out of the car and we're twisting our knees in all these weird angles that it's not meant for. So when, when you're sitting in a car, you want to make sure you can completely rotate out and then you get out of the car, so all these little things that we do on a day-to-day basis create compensations in our daily lives and routines. So I want to highlight our knees today. Okay, so with that said, let's get started with the treatment of the knees. Again, if there are any questions or anything that comes up during this video, just leave them in the comment section and I will be able to respond to you the best that I can. Okay, so as a body worker, I am also learning. There are a lot of things that I don't know and don't have the answers for. So I will always, if there's something that I do not know and don't have the answer for, I will do my best to find the answer for you or be able to direct you and guide you where you can get that answer. So I'm going to start by lubricating the knee. We're going to lubricate this knee, okay? So let's put some nice ointment. Ashley's Blaster oil works perfectly. I use her face when I'm traveling. I use her face bottles because they're 2 fluid ounces and they let them through the TSA lets it through. So on a carry-on, I don't like to really check in my bags. I kind of, as soon as I land, I kind of want to just go to where I need to go. So I'm going to start with the face blaster. I'm going to start prepping it with the face blaster. So we're just doing knees, okay? Today, just bringing our intention into our knees. And so I'm going to blast all around the patella here, even inside the knees. So some of our blasters, questions come up about how to address fatty knees. So fatty knees is a compensation due to possible alignment issues of our legs. I used to see it a lot in my clients that wore heels because, as you know, when you're standing, right, your foot is actually like this on a heel, correct? Right? So what happens with all that pressure that is put on our tippy toes? We start, the impact falls right on that knee. So our bodies begin to compensate because you can tell I don't wear heels. It's hard for me to stand that way, but so when you're in a heel, all that impacts the front of the knee. So that creates compensations in the body. So we want to be able to, if you do wear heels, you want to be able to really make it a point to treat your knees, okay? Get that blood in there so we can realign and relax the muscles around the knee so there's no pulling of any kind, okay? Because that's where certain misalignments happen, okay? When there's tightness in our muscle groups, and if there's one muscle group stronger than the other one, or if there's a compensation, then the muscle pulls it out of alignment. So blasting your knees, if you're a big heel user, is really important, okay? So fatty knees. So I've seen that a lot in my patients, female patients who wear heels. And in my male patients is the way they sit. Males like to sit with their legs open like this. And so what happens there, muscles become tight, other muscles become overstretched. And again, what happens when you have muscles that are tight and overstretched? They start pulling on our joints, and then that's where the misalignment becomes apparent. Okay, so we're going to start by prepping the tissue around the knee joint, just like this. Okay, and we're getting that nice reaction, nice flush look. That's what I'm looking for. Just around the knee joint, go right around it. Okay. If you want to bring it up a little bit more to your thigh, that's fine too. I try to get that blood flow in there. And just around this joint here, just looking to bring blood flow up into the surface layer. Okay, just like that. And we want to get into the little crevices, but we will do that with a refining tool as well. With a nugget. Nugget's my favorite. And blast around the patella. Because remember, the patella is the bone that goes right in front of the femur and your tibia. So what happens here, it is held by tendons, okay? So you want to blast around the patella here. Just like that. Relax those tendons. And up in here as well. Relax those tendons. Just like that. And I'm also going to show you, if we have time at the end of the video, how to tape it so we can bring some awareness and, realign and support the knee joint as we're blasting. Because remember, if there is a misalignment and we're blasting, we are facilitating the inflammation process of the body, okay? And when we do that, the body then regenerates and remodels and lays down soft tissue fibers like your collagen. So it starts laying it down. So of course we need to support it, almost like a scab. When you cut yourself, you have a little scab, you want to try not to scratch it because you might peel it off, right? So we want to try to protect that. So by protecting it with rock tape or kinesiology taping, we're stabilizing that joint. So when we go to strengthen it, it's aligned, and our brain and mind and body connection is is aware, okay, of that stabilization in that joint. So here we go. There's just prep, okay? We went around the patella, going right into the medial aspect of the knee joint. And I used to have some crazy fat pockets here. You know, they're still there. You know, when you're going to do the pinch test on you, you want to try to figure out what state your tissue is in. So I still have a few, a little bit of fat pockets developing here in my knee joints, right here. And that's because my feet have a tendency of doing this. So I'm working on stabilizing and strengthening my ankles. So my ankles have a tendency of doing this inwards. So of course the impact when I walk or run, and which I shouldn't be, I should not be running. I'll really injure myself. But it really ends up on the medial aspect of my knee. And so of course with time, my body was depositing adipose to protect that that joint. It's amazing how it knows when we're compensating, and it just, you know, it's just amazing. Our bodies are so like the energy that, you know, it's just really communicates. Everybody communicates with one another nicely. Everybody's computerized. You know, our body has this innate force to heal itself and protect itself, and, you know, really pushes through to work efficiently when we're not giving it what it needs. So by compensating is exactly what it does for survival. So we are doing our due diligence to continue to provide for our bodies, because it does a lot for us. So by fasciablasting, by bleeding, by cupping, we are facilitating their ability to heal every day. We are healing every single day. So we have that nice flush look going on here. I don't know if you could see it. I know I have a few bruises on my legs, so I'm trying to avoid those areas. I'm not trying to, you know, bruise that, but I just want to show you how to treat this area of your leg. Okay, so once we've done that with the face blaster, we can go in there with a mini one, or if you have a regular face blaster, you can do that as well. A regular fascia blaster, I'm sorry, you can do that as well. Go right above the patella, around the patella, just like that. In nice angles, right? Go into nice angles to try to get around that knee joint. Just like that. Okay, so that's how you do it with the fascia blaster. This is how you do it with the mini one. You just use that one claw to massage, to fascia blast around the knee joint, just like that. Go away, all the way around, just like that. This feels amazing. Love it, love it, love it. And if you want to use the nugget end, you can. Let me see, do I have I have my mini 2. Let me show you how to use the mini 2. Right in here, around. I have Miss Ellie in the background over there, relaxing. I just took her a bath, so her hair is everywhere right now. I gotta put her hair in a ponytail. So we are going all the way around the knee joint with our mini 2, all right? Okay. You're just massaging it, bringing it up into your lymph nodes. So we are facilitating the lymphatic system here, right? We're helping it to get all the good stuff and the bad stuff and all the stuff that it needs to do to so we can heal and remodel, correct? Right? Just like that, okay? So then we're going to go in with a nugget. So you could either use the mini one, the nugget on the mini one, and fine tune and refine all around the knee joint here, and try to find for some sticky stuff. If you need to use your gua sha tool or your blade, try to see if you can find. There we go. I have it all in here, just exactly where that fat pocket I was showing you guys earlier. So I'm going to use my nugget to get in there and really refine this target area where I find those crunchies, because essentially that's what you're feeling for, right? You're feeling for crunchies or any sticky tissue. So this is why I like the gua sha and the bleeding tools, because they assist me in finding where the tissue is compromised. So I'm gonna go back and forth just like that into that fat pocket. You know, so as you can see, I'm pulling my skin, right? I'm pulling it this way as I'm going back and forth, just like that. Just like that. And working deep. Okay, and if you have the fat pockets around your patella, do the same thing. Just pull the skin and work around it. Work around the patella. Okay. And you can also go around the patella. Okay. If you have fat pockets on the outside of your knee, same concept. Just go right in there. And nugget. And crayon. Actually, this is the crayon technique, right? Because we're just on the, we have the nugget at an angle, so we're crayoning back and forth. You can also do the poke and wiggle method as well. You can also use that technique. The poke and wiggle, what I would do, see if I go back here into this fat pocket, what I would do is I will pull the skin, poke it, and wiggle. I feel that. So that is actually really, really deep. So poke, wiggle, poke, wiggle, poke, wiggle, just like that. Just like that. So by doing this, by pulling on that skin and really anchoring it like that, it assists me to really getting into those deeper discrepancies in my tissue. Okay, I actually love my nugget, my wooden nugget. It helps me find things easier. For whatever reason, using the wooden nugget, it really helps me you know, pick up discrepancies within my tissue. So I'll do the same thing, poke and wiggle with the nugget. Just like that. And if you're interested in wanting to know how to cup your knee, I'm going to show you how to cup your knee real quick. All right, just like that. I like to use the medium size cups because they kind of really get in there for me. And just like that. Wow, that is strong. Woo, that feels amazing. Just like that. Okay, you can keep them stationary. I like to use a few cups just to really do that target area, you know, really focus on the area that I'm treating. Just like that. All right, and if you need to mobilize, you can mobilize, right? Back and forth, bend the knee, just like that, to get it to. If you have range of motion issues, you can just put your cups around just like this and just mobilize that knee joint. And I mean, you can really do that around your knee. Okay. So then if we want, we're going to do the other side. So, right. Right. Just like that. Look. 1, 2, 3. Ooh. Mobilize. And if they pop off, pop them back on. Okay, just like that. That feels good. Go ahead, put it back on, and mobilize. Okay, and then you can remove them and gently massage. It's nice and warm, the area. Nice and red. Have a nice, we have a very nice reaction here. So I'm going to teach you how to tape your knee for alignment purposes and for stabilizations and to get that mind and body connection, because that's what the tape is. So the tape is just to stimulate sensory, to make your brain aware of your place in space. So the same thing goes with our bodies. Our brain always scans to see where our body is, if it's safe, if it's not compensating and things like that. So after we blast, we want to make sure, right, we got that inflammation going. And the beautiful thing about taping is that it helps. It helps get the good stuff in and good stuff, get all that good stuff and bad stuff moving. If there's swelling going on, the taping helps greatly with swelling and inflammation. So I want to show you guys how to tape. I'm a big rock tape fan. I like the Tape RX because I have sensitive skin. But because I don't have that, I only have a certain amount of tape here in my house in Florida. So I kind of used it up the other day. So I'm going to show you how to use the Kinesiology taping. This is TheraBand tape, but they're both great. They're both good to play around with and to, to really play around with your body and be creative with it and see what works for you. Because not everything works for everybody. My body works, things can work differently for my body than it would with yours. So I'm just going to play around with this TheraBand tape. All right, so we're gonna start with the knee at 90-degree angle, just like that. And then I'm going to peel off this tape. I'm not adding any stretch. I'm just aligning it here with my knee joint, just like that. Just make sure the area is clean before you apply it. But because this is just a demonstration that I'm doing for you guys, I'm not keeping this tape on. So I'm just gonna go right around like a nice letter C, right around that knee joint here, okay? And right away, there are sensory and messages being sent to the brain with just having this tape on. So this tape is pretty awesome. How it works, it's really cool. I love it. I incorporate it every chance I get, with my sessions. And if I need to align something like my foot, I like to use tape to do that. So then here we go with the other side. We're going to align it, tack it, and then with a very little stretch is applied, very little stretch, but because you want to try to get that letter C around your knee joint. There we go. Perfect. There we go. And if for any reason the tape begins to itch and you scratch it or have any kind of reaction, just remove the tape, okay? Because that just means that you're probably sensitive to the adhesiveness, of the tape. So that's where you got to find the tape that works for you. There's so many awesome brands out there. There's Kinesio taping, Rock tape, TheraBand tape, KT tape. So you kind of have to play around and figure out which tape works best for you and your skin and your body. So I have my knee nice and taped, so when I'm walking around, my brain is aware that it is safe, and we're aligning it. And with this tape, you are allowing for the healing process to take place after we have treated it with the Fasciablaster or blading or gua sha or cupping. So it allows it to heal properly. If you have any further questions, please let me know and leave them in the comments below. Thank you so much and have a great night.